Welcome back, students. We are in Modular 8, and this modular is focusing on healthcare. And this is video 2 of 3 videos on this particular modular. I hope possibly you had a chance to take a look at the Aaron Brockovich video that is part of the overall modular, and take a look at that video, and we'll talk a little bit about how the information that was located in that video is related to what it is that we're going to talk about in the PowerPoint. So when it comes to having to make decisions about how money is going to be spent relative to healthcare, there are often situations where either moral or ethical concerns come into play. Moral and ethical concerns are often part of the resources that an individual, a policymaker, a hospital administrator, even maybe a doctor or a nurse are going to make when they're having to decide whether to proceed with care or whether to not proceed with care. The bottom line is that there's less money available to cover the costs for medical care than there is relative to the expense of medical care. So the pot to pay for medical care is smaller than the amount of money that we need for medical care. And so decisions have to be made, choices have to be made about what to prioritize and what should be, what should you proceed with. And that often results in using moral and ethical decision-making around healthcare issues. So how much of our country's resources should be spent on healthcare, and how should those resources be allocated? That's kind of the big question. That's what I was trying to say like 20 seconds ago. That was a very succinct and easy way to say it. The issues of concern that affect healthcare costs, there's things like premature births and organ transplants. How much of our healthcare funding should be allocated to research, education, treatment? Can the government mandate good health practices? So in other words, can you tell a female drug user who wants to get pregnant that she should not get pregnant? Can you tell people with AIDS who are practicing unsafe sex that you might deny them care? Or patients with heart disease who do not exercise or maintain their weight? Who should pay for healthcare for those unable to afford it? Should it be the government, states, communities, or individuals? So those are those kind of moral and ethical concerns that often come into play when you're trying to decide where you're going to position your healthcare dollars for all of the expenses that are involved. As early as the Greek and Roman eras of civilization, it was observed that many health problems were associated with changes in the environment. Environment and lifestyle continue to play big roles. As an example, more often than in the past, cancer diagnosis can be traced back to environmental hazards, such as you saw in the video regarding Aaron Brockovich, who was instrumental in building a case against the Pacific Gas and Electric Company in California in 1993. So it's just important to recognize that there can be a role in terms of healthcare and healthcare advocacy to be looking at environmental factors in a given community. We certainly know that asthma is a significant healthcare related issue for a lot of residents who live in the Central Valley. And when the environment changes and we have things like fires or extremely hot days or really volatile weather patterns, all of those kinds of things are contributing factors to why people might get sick with their asthma. And so that's a way of being able to sort of begin to think about linking social work, the environment, and healthcare as something to be thinking about and just to be aware that it has a direct relationship on the clients or the communities that you might be working with. So there are a number of different factors that affect health. The greatest contributors to premature death in the US are not individual hereditary factors, sort of what you're born with in terms of what your family has passed down to you, but it's environmental and lifestyle factors. All of these factors interact with the environment and lifestyle factors to either increase or decrease the likelihood of good health. Things like income, ethnicity, gender, age, disability, and residency, or where one lives. And let's get really clear. I think we've talked about environmental. We kind of know about what we're talking about there. When we talk about lifestyles, we're talking about all those things that we're always hearing is in our best interest in terms of our health. So what we eat, do we exercise? What's our alcohol intake? Do we use cigarettes? Do we use drugs? Those are all kind of lifestyle factors that come into play that can have an impact on either good health or bad health. And those kinds of factors, what we eat, whether we can exercise, those kinds of things can have a direct relationship to things like income, ethnicity, gender, age, disability, and residency. So we're going to take a look at that. So the first one that we're going to look at is income. Factors that affect health. Income, health status have a direct relationship. So those that have a higher income often have health insurance. So they're able to see a doctor and be able to do preventive efforts to try to prevent something from happening, but they're also able to get in to see a doctor early before a condition becomes so serious that it may result in death. People with higher incomes often seek medical care earlier and more often. They may buy and eat more nutritious foods and have less stress. And it's becoming more and more clear the effect that stress has on our physical health. And so this is going to be a theme that will kind of carry through all of these particular factors, but stress can come from, struggling in terms of income issues. It can come from living in unsafe neighborhoods. It can come from challenges in relationships. It can come from so many different places. And all of those can create stress. And in turn, that stress can have a effect on your physical body and possibly have an impact on your immune system so that you are more susceptible to different kinds of illnesses that you may be exposed to. So conversely, low-income individuals are more likely to live in environmentally unhealthy places. They do not have access to health services regularly. They have less access to healthy food choices and have higher stress. So low-income individuals may live in communities where there's more pollution. For instance, some studies have indicated for those neighborhoods that are located in close proximity to freeways that are built to drive through the middle of town, they're being exposed to a lot more pollutants than maybe somebody who's living in another part of the city. Certainly, if you're living in a community where it's unsafe to walk at night, or a community where there is ongoing violence, particularly gun violence, that can generate a lot of stress, where you worry about your kids or worry about your family. And if there's no place to go walk, there's no parks available, the sidewalks are not safe, or even just the neighborhood is not safe, then the ability to be able to get out and get some exercise impacts you. Healthy food choices. Again, if you find yourself with limited transportation resources, limited income, you may find yourself shopping at your local liquor store. And while a lot of those kinds of businesses do provide some food choices, they're rarely the healthiest of food choices. Rarely are you going to find fresh fruits and vegetables at that particular kind of store. And so that can be a contributing factor in terms of income as well. So examples relative to income. Uninsured babies are 30% more likely than insured babies to die or to have serious medical problems at birth. And the infant mortality rate of births to women living in poverty is more than 50% higher than for women above the poverty line who are giving birth. So obviously, if we're looking at an uninsured baby, most likely we would be looking at an uninsured mother. Although Medi-Cal will cover the cost for prenatal care, if a mother is not aware of that, or maybe is not even aware of the fact that she's pregnant, she may not be getting prenatal care. And a lack of prenatal care would result in a problematic pregnancy and possibly a baby who's at risk for health problems. Nationwide, nearly 13% of children living in families are at or below 200% of the federal poverty line that had no health insurance in 2016. So again, these working poor, working families, and again, the lack of income has a direct relationship on the children having access to health insurance. Many of these children may have been eligible for programs such as Medicaid, which again is Medi-Cal in California, or even the state children's health insurance program, which is called S-CHIP. But people have to know about those programs and know that they can apply and not feel at risk if, for instance, their undocumented status they feel is going to impact their ability to be able to access those services. Next, we're going to take a look at ethnicity. Primarily because of higher income, whites enjoy better health care than people of color. I want to emphasize because of higher income. Life expectancy for groups of color is less than it is for whites. People of color are more at risk to develop and suffer from chronic diseases than whites. And infant mortality rate is defined as the number of infants who die at birth or before they reach a certain age compared to the total number of infants. Infant mortality is twice as high for people of color as for whites. In a large number of large urban communities in California, you will often find a program that is identified as the Black Infant Health Program. And this is a program that's specifically designed to accommodate and educate and monitor the incidence of infant mortality, particularly in the African American community. Often, again, it goes back to things like exercise and nutrition. And so again, people of color who may be living in poverty are going to be at risk for things like diabetes and asthma, simply because of things like access to nutritional foods and also opportunities for exercise. There's also been some interesting studies about the tobacco industry and the way that historically the tobacco industry has marketed to the African American community. And so for a number of years, the number of tobacco users, tobacco consumers for a certain number of products have been predominantly African American. So there's another contributing factor in terms of ethnicity and health issues. People of color may be less likely to seek health care for themselves and their children due to economics. There are often issues around childhood immunization or prenatal care. We talked about prenatal care. Research indicates that low socioeconomic status is the link between high blood pressure, and ethnicity, resulting in heart disease, stroke, and diabetes, and environmental stress due to oppression and a lack of access to social and economic resources. So the relationship between high blood pressure and heart disease, stroke, and diabetes. High blood pressure, again, related to the food that you're eating and your ability to be able to exercise. And so again, going back to not so much the ethnicity piece, but quite often because those people may be living in poverty. Next, we're going to talk about gender. The average life expectancy for women is greater than that for men. So you can see the statistics there, 76.2 years for men, while the average is 81 years for women. Due to the inequality in income between men and women, retired women may actually receive less Social Security income than a male of the same age. So as we discussed a few modulars back, women are often suffering within the pay gap, right? And so if the amount of Social Security income that you are able to access at the point of retirement is based on the amount of money that you made during the time that you were working, then if you were making less money, i.e. a female, as opposed to a male, then the amount of Social Security you're going to receive every month is going to be less. As a result, women are more likely than men to spend their last years living in poverty, which places them at risk for experiencing poor health. Factors that affect health: age. Our country's oldest and youngest citizens are at highest risk for poor health. Older adults are at risk due to aging because many of them are living in poverty. 33% of elderly today are poor and do not seek health care due to costs. 5.2 million older adults in the US may have been diagnosed with Alzheimer's disease. 15 million by the year 2050. Alzheimer's disease is the 6th leading cause of death among white males. So this is a growing phenomenon in terms of cause of death, particularly for older adults. The US has a higher infant mortality rate than any other Western country, 6.1 deaths per 1,000 live births. Children are at risk again as a result of poverty, and children living in poverty is a growing issue in the US. Major causes of death vary significantly by age. Accidents is #1 cause for those under the age of 25, and homicide is one of the top 3 for those ages 15 to 25. So, in other words, being murdered is another term for homicide. Last modular, you hopefully watched the video about children living in poverty in the United States, and you saw how that could impact an individual's health. So I think that's significant in terms of what we just are talking about here. And finally, we're talking about disability. Persons with temporary or permanent disability are at greater risk of having serious health problems than persons without disabilities. They're much more likely to have Medicaid or Medicare coverage, to live below the poverty level to receive public assistance. Health problems are often compounded by the lack of affordable, accessible, appropriate health care, especially for prevention services. And 12.6% of the US population has a severe disability. And these could be both physical as well as mental disabilities. And finally, one more, we're going to talk about place of residence. We know that living in a rural community or living in a highly populated urban area can be contributing factors for health problems. There may be more environmental hazards in an urban area, things like pollution and increased stress. Over half of people who live in poverty are actually living in rural areas. There may be very limited medical resources in a rural community, and individuals in rural areas are more likely to suffer from emotional disorders than people in urban areas. Interesting. So where you live, ethnicity, gender, age, disability, all contributing factors to positive or negative health outcomes. Okay, so we are going to stop here, and when we come back, we will move into some more content, particularly taking a look at this ecological perspective when we're talking about health. I hope now that you will take a look at the video, Healthy People 2000, Determinants of Health, because I think it really does kind of go back to some of these elements that we were talking about, again, gender, ethnicity, disability, those pieces. I think it really helps to highlight and give you some great examples. So I hope you'll take a look at that, and we will be back in a little while with video 3 of 3 for Modular 8 Healthcare.